Imagine a silent enemy, invisible to the eye but powerful enough to suck down entire cities, collapse healthcare system and take lives within days. A virus so deadly that even a single contact can turn into life or death situation. From the fear of COVID-19 to the terrifying outbreak of the past, humanity has faced many battles, but few are as frightening as Ebola virus disease. First discovered in 1976 near the Ebola River in the Democratic Republic of the Congo. This deadly virus has since shocked the world with its rapid spread and high death rate. It hides in animal, jumps to humans and spreads through direct contact with infected body fluids, turning families, hospitals and entire communities into the zone of fear. This is Parinita and today we uncover the truth behind this deadly virus, how it speaks, why it is so dangerous, the history of its outbreaks and how science and awareness are fighting back. Because this is not just a story of disease, it's a story of survival, struggle and the fight between humanity and one of the deadliest viruses ever known. Every year, millions of people across the world lose their lives to deadly diseases and dangerous viruses. From cancer and malaria to HIV, dengue and deadly outbreaks like COVID-19 and other diseases. Humanity continues to face invisible enemies that can spread fear within days. The COVID-19 pandemic alone changed the entire world. Hospital collapsed under pressure, family lost loved ones, economic stopped and the millions were forced into lockdown. According to the World Health Organization, more than 776 million cases and over 7 million confirmed deaths were officially reported worldwide. While some studies suggest the real death toll could be much higher. COVID-19 was first detected in December 2019 in the city of Wuhan. Doctor noticed several patients suffering from a mysterious phenomena like illness linked to seafood and live animal market in the city. Chinese health authorities later identified the cause as a new coronavirus, officially named SARS-CoV-2, as the virus spread rapidly across the country. The World Health Organization declared COVID-19 a global pandemic on 11 March 2020. The outbreak soon became one of the deadliest health series in the modern history, affecting millions of people worldwide through infection, death, lockdown, and economic disruption. Just when the world is recovering from the devastating impact of COVID-19.
Currently, we are testing people who have an acute respiratory infection, so they have respiratory disease that's come on quite suddenly with fever or cough or shortness of breath or a sore throat. If you're ill, then you need to look and see if you have any of the other criteria. And these criteria include, have you traveled from a country where coronavirus is circulating in the community? Or have you been in contact with a suspected or a confirmed case of the coronavirus? Or are you a healthcare worker in a healthcare facility where patients with the coronavirus have been seen? If you meet any of those criteria, then you qualify to go for the test. Even if you don't have any of those, what we call epidemiologic criteria, so even if you haven't traveled or contacted someone with the virus, if you're admitted to hospital with pneumonia, you should also be tested. And that last one is really to make sure that we don't miss any cases that aren't in any of the other groups. And very importantly, those criteria are updated all the time. Right now, the cases that we are seeing are really in travelers from areas where the virus is circulating and in their close contacts. But as the situation progresses, the countries where the transmission occurs will be updated and also the criteria may be updated. So the first thing to do is to liaise with a healthcare worker to arrange to be assessed by that healthcare worker for them to also decide do you meet the criteria, and then if it's needed, have the test. And importantly, we know there's a possibility that if you're coughing and sneezing and you have the virus, we don't want you to go and mix with a whole lot of other people in the doctor's waiting room. So if possible, you should call ahead to your GP and tell them over the phone, these are the signs and symptoms, I'm worried that I've got the coronavirus, and they will either tell you, how to get to their facility in a way that you can be separated from everyone, or they might refer you to a laboratory or somewhere else where you could have the test. If you're using a public healthcare facility, then what you should do is really identify yourself immediately to somebody in charge and tell them that you're concerned about the coronavirus so that they can isolate you and separate you from everybody else. The next thing is to be assessed by that healthcare worker who will make the decision if you need testing, and to make that decision they can also phone our hotline if they're not sure what to do, which is for healthcare workers, and get advice. So the test we do for the virus looks for the virus in the respiratory tract where the infection is. So they'll take a swab from your nose and throat and send it off to the laboratory to be tested for the coronavirus. While you're waiting for the test result, it's very important that you go home and you self-quarantine and limit your contact with others until you have the results of that test, so that if you do have the infection, you don't spread it on to other people. And then your healthcare provider will provide you of the result, and if it's positive, there'll be a number of actions to make sure that you get the proper treatment and that all of your contacts are followed up. And if it's negative, then depending on the situation, you may be able to go about your daily activities. But if you are a person who's traveled back from a high-risk contact country, or you are a contact of confirmed case, you will still need to complete those 14 days of self-isolation, even if you've had a negative test. And the reason is that even if the test is negative, you could still be incubating the virus and it could come positive at a later stage, and continue self-isolating even if the test is negative.
Another deadly virus continued to threaten humanity, the terrifying Ebola virus disease, known for its high death rate and horrifying symptoms. Ebola remains one of the most dangerous viral diseases ever discovered, since its first detection in 1976 near the Ebola River in Democratic Republic of the Congo. The virus has caused multiple deadly outbreaks across Africa. There are 6 known type species of Ebola virus disease, each belonging to Orthoebola virus genus. This includes Zaire Ebola virus, which is the most dangerous and responsible for the largest outbreak in countries like the Democratic Republic of the Congo and 2014-16 epidemic in West Africa. Sudan Ebola virus has also caused several outbreaks, mainly in the Uganda and nearby regions. Bundibugyo Ebola virus was first identified in the Uganda. It's known for causing smaller outbreaks. Other species include Thai forest Ebola virus, which has laid very few confirmed human cases in West Africa. Reston Ebola virus, which family affect animal and has been detected in the Philippines and the other region, but it's not known to cause disease in humans. And the Bombali Ebola virus, discovered more recently in bat and still under study. Among all types of Zaire Ebola virus is considered the most lethal and is the primary under study, target of current vaccine and treatments. Today we talk about a deadly virus that once spread fear across the world and claimed thousands of lives, and terrifying Ebola virus disease. A disease so dangerous that even a small contact with an infected person can become life-threatening. High fever, bleeding, organ failure, rapid death. Ebola is not just a virus, it is a warning to humanity about the power of deadly infection. First discovered near the Ebola River in Democratic Republic of the Congo. The virus shocked the medical world with its terrifying impact. Scientists believe fruit bats carry the virus naturally, while humans become infected through contact with infected animal or body fluids. In today's video, we will uncover how Ebola spreads, why it is so deadly, and the symptom people must never ignore, and how the world is fighting to stop future outbreaks. Stay with us till the end. According to the World Health Organization, more than 38,000 Ebola cases and over 1,500 deaths have been reported globally across different outbreaks, with the world epidemic occurring in the West Africa between 2014 and 16 in Guinea, Liberia and Sierra Leone. The virus spread through direct contact with infected blood. Body fluids, contaminated objects are injected animals, making it extremely dangerous for family and healthcare workers. The first known human case of Ebola virus disease were identified in 1976 during two simulations outbreak in Central Africa. One of the earliest recorded patient was school headmaster named Mabalo Lokela from the village near the Ebola river in the Democratic Republic of the Congo. They know as the Zeri. He reportedly became ill after traveling and was treated with the contaminated needles at a local hospital, which helped the virus spread rapidly to the other patients and healthcare workers. Around the same time, another outbreak occurred in Sudan. Scientists later named the disease Ebola after the nearby Ebola river to avoid stigmatizing the village where the outbreak began. The exact original animal to human transmission is still uncertain, but researchers believe infected fruit bats or wild animals were likely source of the virus.
Declaring the FIC, I immediately convened an emergency committee under the IHR, which met yesterday and agreed that the situation is a public health emergency of international concern, but is not a pandemic emergency. WHO assesses the risk of the epidemic as the high at the national and regional levels and low at the global level.
According to the latest update from the World Health Organization, Ebola virus disease does not have single fixed global total of affected people like COVID-19 because it occurs in separate outbreaks rather than the continuous worldwide transmission. In the most recent reported outbreak 2026, there have been several 650 suspected cases and over 100 suspected deaths, with confirmed cases changing as laboratory testing continues. Ebola virus disease and the COVID-19 differ greatly in terms of spread and danger. Ebola is highly deadly disease with a very high fatality rate in many outbreaks, but it spreads only through direct contact with infected body fluids such as blood, vomit, sweat, which make it easier to contain and limit its spread mostly to close contact cluster. In contrast, COVID-19 spread mainly through the air via respiratory droplets and aerosols, making it highly contagious and capable of rapid global transmission. While Ebola outbreaks are usually localized and occur mainly in the part of Africa, COVID-19 became a worldwide pandemic affecting every continent. Ebola is therefore more severe in the term of individual mortality, but COVID-19 is far more dangerous in terms of the speed of the spread and global impact. The cumulative outbreak data for the Ebola virus disease show that the most affected country in the Democratic Republic of the Congo, with around 15,000 plus suspected and confirmed cases across multiple outbreaks, making it global hotspot for repeated Ebola flare-ups. In Guinea, about 3,800 plus cases were reportedly mainly during the major 2014-16 West Africa outbreak along with some smaller other later outbreaks. Liberia experienced around 10,000 plus cases during the same West Africa epidemic, while Sierra Leone recorded approximately 14,000 plus cases, making it one of the worst hit countries during that series. In Uganda, there have been about 500 to 600 cases across several smaller outbreaks over the year. Other countries such as Nigeria, Mali, South Sudan and reported only sporadic cases, usually in small clusters of fewer than 100 cases each, often quickly contained through rapid public health response. Screening and checkpoint on major internal roads in different countries and the public health measure used to control the spread of infectious disease like Ebola virus disease. In countries such as the Democratic Republic of the Congo and the Uganda, authorities set up health screening points on highways, border crossing and the key travel routes to check travels for symptoms like fever and identify suspected cases early. Similar measures have also been used in past outbreaks in countries like Guinea, Liberia, Sierra Leone, where movement control helped reduce transmission during the major epidemics. At these checkpoints, health workers conduct temperature checks, collect travel history, and refer suspected individual for isolation and testing, while also sharing information with surveillance team to improve outbreak response and prevent further spread across regions.
For having me here. Of course, Ebola is a highly contagious and highly fatal pathogen, so anybody would be concerned and alarmed. The good thing, this would be our ninth outbreak, and we have managed to receive those two cases which were imported from DRC seeking care. One died, the body was repatriated, and another one was declared recovered yesterday. So as we speak today, there are no active cases of Ebola in Uganda. However, knowing Ebola for what it is, of course, they traveled that long journey up to Kampala to seek care. We have over 100 contacts being investigated to see whether they turn Ebola positive. So there is high surveillance alert. Two, we have a 700-kilometer porous border, and that is why the government has decided to suspend trade and travel for about 4 weeks. Thirdly, we also have very many refugees pouring in from Eastern Congo. You mentioned very well, there are wars in the DRC. So these factors have made Uganda vulnerable and is ranked under high risk. But I must make it clear that while Ebola is viewed with such drama and fear because of the high case fatality, malaria is still the biggest killer in Uganda, and therefore, relatively, we are still going on about our businesses very well. Tourists are coming to Uganda, events are going on, although we are heightening our public health practices, hand washing, not shaking hands, very careful with the barriers, reporting, high fever, particularly the 12 districts which have been designated at the western border of Uganda, which is the eastern border of Congo. One is the politics, and two, the wars. And the third one, which would fall under politics, is sanctions. This is an internal contradiction that Congo, which is the richest country in Africa and probably the world in terms of mineral wealth, is still not having a system or a mechanism to, actually prevent, control, and even, maybe eliminate such outcomes. One, there has been ongoing war, a war of political instability. Congo has never settled since the murder of Lumumba to date. They have this vast mineral wealth, so the private enterprise or the capitalist enterprise is in Congo, keeping it busy and never settled. So as such, the health system is not robust enough. The governments have not been strong enough to set up state structures in Congo and be able to deliver primary health care effectively for a long period of time. Secondly, of course, there is the human-environment interaction in search of survival, causing interaction with high-risk environments. And thirdly, there has been a dwindling amount of resources going to public health entities in African countries, given the sanctions regime and also the change in approach by the new administration of the United States. It took 6 weeks for the DRC to detect and confirm that actually this is Ebola. But it could have taken a much shorter time working within the African Union mechanism, working within the East African Community mechanism, but that doesn't seem to have worked very, very well. Of course, studies have shown that where there is war, where there are sanctions, the public health systems break down and lead to disease outbreaks, even if they are just communicable diseases of waterborne nature, such as cholera. This has happened in Iraq, this has happened in Syria, this has happened in Palestine. And it's the same thing happening in Congo, which is now a fragile health system. In Uganda, however, we have managed to put up very robust systems, activated our rapid response teams in the districts, increased our advocacy, communication, and social mobilization, and mobilized state resources. And this is what I think the African governments should do. They should not wait for aid. They should argue for trade so that they have sufficient resources, the human resource, a laboratory network which should be strengthened, and of course the ability to have money to cause initial investigation timely and effectively.
In India, an Ebola alert for Ebola virus disease is mainly preventive public health preparedness measure, not an indication of widespread infection. The World Health Organization has never reported any major Ebola outbreak in India, but the country remains alert due to the risk of important cases through international travel from the affected regions. In past years, especially after the 2014 West Africa outbreak, India strengthened airport screening, quarantine facilities and the rapid response team to identify travelers showing symptoms like fever or recent travel history to high-risk countries such as Democratic Republic of the Congo or the other outbreak affected area. Hospital and health authorities are trained to isolate suspected cases immediately and conduct laboratory testing to rule out the infection. So the Ebola alert in the India is primarily precautionary surveillance system to ensure early detection and prevent any possible entry or spread of the virus. There is also a vaccine for Ebola virus disease, but it is important to understand that it is not a single universal protection against all Ebola types. The most widely used vaccine is Ervevo, which has been approved mainly for the Zaire strain of Ebola virus, the strain responsible for the largest and the most deadly outbreaks. This vaccine has been used effectively during emergency outbreaks response in countries such as the Democratic Republic of the Congo, where rapid vaccination of high-risk individuals has helped control to spread the disease. The vaccine is usually given through the strategy called ring vaccination, where people have been in direct contact with infected patients as well as healthcare workers and frontline responders are vaccinated first to break the chain of the transmission. According to the World Health Organization, this method has proven effective in reducing the spread of outbreaks when combined with isolation, contact tracing and the strict infection control measures. However, despite this advancement, there is still no single vaccine that protects against all known species of Ebola virus. Different strains exist and some are still being researched for vaccine development. Scientists continue to work on creating broader and more advanced vaccine that could not provide protection against multiple Ebola strains in the future. Along with vaccines, supportive medical care, early detection, public health measures remain essential tools in saving lives during outbreaks. To protect yourself from Ebola virus disease, it is very important to understand that the prevention is mainly based on avoiding exposure rather than the routine medicine. The World Health Organization strongly advises to people to stay away from any showing symptoms such as unexplained fever, severe weakness, vomiting or bleeding, especially in outbreak regions. Community awareness plays a key role because early identification and reporting of the suspected cases can stop the spread before it becomes severe. People are also encouraged to follow safe food practices and avoiding handling or eating bushmeat from unknown or wild animals, which may carry the virus. In healthcare settings, strict infection prevention and the control measures are essential. Hospitals must isolate suspected patients immediately in separate treatment areas, and the medical staff must use full protective gear such as gloves, masks, gowns, and the face protection to avoid contact with infection fluids. Equipment used for treatment must be properly disinfected or safe. Dispose of to prevent contamination. Safe and defined burial practices are also extremely important because the virus can still be present in the body after the death. In addition, vaccination with Ervevo is used to outbreak zone to protect high-risk groups such as healthcare workers and people who have been close contact with infected individuals. Rapid response team, contact tracing and the community education also help control outbreaks effectively. Overall, Ebola prevention depends on awareness, hygienic, rapid medical response and the strict safety protocols, which together save lives and stop the virus from the spreading further. Ebola is a reminder that the smallest invisible threat can challenge the strongest system in the world. but it is also a reminder that the humanity has never been powerless. From frontlines to hospital to the silent efforts of scientists and health workers, every battle against this virus has shown courage beyond fear. The real fight is not only against the disease itself, but against ignorance, delay, and the carelessness. Where awareness spread faster than the infection, even the deadliest virus begin to lose its strength. In the end, every outbreak teaches us one powerful lesson, and the survival depend not only on medicine, but on discipline, responsibility, and unity. If we act early, stay informed, and protect one another, we turn fear into control and danger into prevention. And that is how humanity continues to stand strong even in the face of the most dangerous virus the world has ever seen.